Hello everyone, this is actually a continuation of the dissection series. So we started with the pectoral region. I have done 2 sessions on that. Now we are moving on to the dissection of axilla. So if you are finding it useful, please let me know so that I will be continuing with this series. So this is just a quick recap or a quick briefing of the topics which you will come across during your dissection on your daily basis. So before you move on with your dissection topics, you can just watch this video so that you will get an overall idea of what you are going to see and what are the things which you are going to focus. That is why I am doing this series. Okay, so after pectoral region, we are moving on to the axilla. Axilla or armpit is just a space between the humerus and your thorax. And when we discuss about the axilla, we discuss the axilla under the following headings. It has got an anterior wall, it has got a posterior wall, it has got a medial wall, it has got a lateral wall, and you have the apex and base. So this is how you will be describing axilla, and axilla can be asked as a short note. It's a very favorite question for discussion, for essay, for short note. So you should focus on some of the important points in axilla. So anterior wall, we know it is mainly the anterior axillary fold from the clavicle, this region, and we know the main muscles which we have already seen in the pectoral region, that is pectoralis major, pectoralis minor and subclavius. These are the 3 important muscles coming in the anterior wall of axilla. Now coming to the posterior wall of axilla, we have the subscapularis, teres major and latissimus dorsi. Subscapularis, teres major and latissimus dorsi. These are the muscles forming the posterior wall of axilla. Now we mentioned about the anterior and posterior axillary folds. They are actually the lower end of 2 main muscles. So the anterior axillary fold is the lower margin of the pectoralis major in the anterior aspect, and the latissimus dorsi in the posterior aspect will be forming the lower margin of the lower margin, and that lower margin is actually forming the posterior axillary fold. Now medially we have the thoracic cavity, isn't it? So it is actually the lateral wall of the thorax, which includes the first 5 ribs and their intercostal spaces. So that is actually the medial wall, and of course these spaces are actually filled with one muscle known as serratus anterior. Now laterally when you look, it is the humerus, and humerus there, it's not the bone exactly what you see, but you have 2 important muscles there. They are the biceps and coracobrachialis, and the importance of these 2 muscles, biceps and coracobrachialis, is that they both arise from the coracoid process of scapula. That's very important. So sometimes for the spotting exam, the coracoid process of scapula will be marked, and you will be asked what are the muscles attached to that process. So they are the biceps and coracobrachialis. That's very important. Now talking about the apex of the axilla. Apex of the axilla is actually formed by 3 main bones. One is the clavicle, then you have the first rib like this, and posteriorly you have the superior border of scapula. So these 3 bones, the upper ends, will form a triangular like opening. That is actually the apex of the axilla. Now this apex of axilla is actually continuous with the root of the neck as well as the superior aperture of thorax. Root of the neck, why? Because you have the brachial plexus, the nerve supplying the upper limb, entering into the axilla through the apex of the axilla. And why is it continuous with the superior aperture of thorax? It is because you need the blood vessels for the upper limb, and that is actually coming from the thorax through the superior thoracic aperture and entering through the axilla, through the apex of axilla into the upper limb. That's again very, very important. Now when you talk about the contents of axilla, we have all these vessels, nerves, lymph nodes and loose fatty tissue. Now when we talk about the lymph nodes, these lymph nodes won't be enlarged unless there is an infection at the time of death. So that's the reason why, even though you appreciate the nerves and the blood vessels, you won't be seeing any of the lymphatics except for the largest lymphatic duct, that is a thoracic duct in the thoracic cavity, or anywhere else if you dissect, you won't be seeing any of the lymphatics, and sometimes at some places you will be seeing the enlarged lymph nodes. That the reason is, at the time of death, that person might have been suffering from some malignancy or some infections whereby the lymph nodes have been already enlarged. Now in order to identify one important nerve in this region in the arm, that is the musculocutaneous nerve. that nerve is actually identified by the way it enters the coracobrachialis which it supplies. So that is very important, the identification of musculocutaneous nerve, that is by its position in relation with the coracobrachialis. Now in the axilla, we have the axillary artery and axillary vein. First we will understand the relation between the two, axillary artery, axillary vein. So axillary vein is actually lying medial to axillary artery. There are so many structures in the axilla which you will have to identify. So the first relation, the two important structures, axillary artery and axillary vein. The vein lies medial to the artery. That's first important point. And once you identify the axillary artery and axillary vein, between these two important structures, you have the medial cutaneous nerve of forearm. That's very important. That lies between the axillary artery and axillary vein. And posterior to that, you have the ulnar nerve. So these are the important structures first which you have to identify while you do the axillary dissection of axilla. Axillary artery, axillary vein lies medial to axillary artery. Between the two, you have the medial cutaneous nerve of forearm, and posterior to it, you have the ulnar nerve. Now, once you identify the medial cutaneous nerve of forearm, the next one is to identify the medial cutaneous nerve of arm. So we have already identified the axillary vein, right? So medial to the axillary vein, you have the medial cutaneous nerve of arm. When we discussed the pectoral region, we mentioned that this medial cutaneous nerve of arm is having a communication with the second intercostal nerve, that is through the intercostobrachial nerve. So the importance of intercostobrachial nerve is it is actually passing through the axilla and it will be passing between the lymphatics. So if there is any malignancy which causes enlargement of the lymph nodes in the axilla, this intercostobrachial nerve will be passing through those enlarged lymph nodes, and this nerve is again compressed by these lymph nodes, and due to its communication with the medial cutaneous nerve of arm, which is lying medial to the axillary vein, the area supplied by the medial cutaneous nerve of arm, we will appreciate pain over that region. That is actually one applied aspect of the communication of intercostobrachial nerve with the medial cutaneous nerve of arm in malignancy. Now we have the serratus anterior muscle, which is there on the medial wall, which is spreading over the ribs, the first 5 ribs and all. So there is one artery and one nerve line closely related to the serratus anterior. The nerve is the long thoracic nerve and the artery is lateral thoracic artery. So lateral thoracic artery is accompanied by long thoracic nerve, which supplies actually the serratus anterior. So the long thoracic nerve is a nerve to serratus anterior, and along with the long thoracic nerve we have the artery supplying the serratus anterior, that is the lateral thoracic artery, which is a branch of axillary artery. In the next session I will be discussing about the branches of axillary artery, how are they divided, the details of branching, their relations and all. So please keep watching. Now axillary artery, from where it is formed, we know that we have the heart, from where you have the biggest artery, the aorta, arising. Once it reaches the sternal angle, it forms the arch of aorta. From the arch of aorta, you have the subclavian artery arising, isn't it? So it is the subclavian artery which goes to the upper limb, which is continuing as the axillary artery. So at the outer border of first rib, the subclavian artery becomes the axillary artery on both sides, and up to where you call this as axillary artery. Of course, the artery which belongs to the axilla is axillary artery. So up to the lower border of teres major, that is very important landmark when you are asked to identify the spotter. Suppose axillary artery will be tied, you will be asked what is it a continuation of, what does it continue as. What about the extent of the axillary tied structure? What are the branches of the tied structure? These are very important sub-questions which you might get. So axillary artery is a continuation of the subclavian artery at the outer border of first rib, and it reaches up to the lower border of teres major. That's very important. And at the lower border of teres major, the axillary artery again continues down into the upper limb as the brachial artery. Now we know the axillary artery is actually divided into three parts by the key muscle of the pectoral region, which was pectoralis minor. So the region lying above it, you call it as superior or upper, or the first part. Then the second part is actually lying posterior to it, and the third part is actually lying below the lower border of pectoralis minor. That's very, very important. Now when we study the brachial plexus, we have three chords for the brachial plexus: lateral cord, medial cord, and posterior cord. So the next question is, how are these chords named lateral, medial, and posterior with respect to what? So these are actually named according to the second part of axillary artery. This is again a very favorite question. So in the first part, all these chords are actually lying posterior to the first part of axillary artery. But when it comes to the second part of axillary artery, which is actually lying beneath the pectoralis minor, the brachial plexus cord, which is lying medial to the artery, axillary artery, call it as medial cord. The brachial plexus cord, which is lying lateral to the axillary artery, you call it as lateral cord, and the brachial plexus cord, which is lying posterior to the artery, you call it as posterior cord. So all of you, please locate all these structures while you do the dissection, and you should always remember all these important points, which are the favorite questions for the examiner. Please let me know whether it is useful to you. If it is useful, I'll continue with the dissection series. Just a quick briefing of what are the topics which you are going to see and what are the questions which you can expect, so that you will stress on that point while you do the dissection. So thank you. Thanks for watching.